Hello and welcome everyone. As you all know that PDCET exam date has been declared and it's on 12th of April 2026. So PDCET aspirants are now uh, focused on preparation and plenty of time is left for them. It's 27 January today and whole of Feb and March and few days of April are there. So almost 2.5 months is there, so it's sufficient time to prepare for PDCET exam. Difficulties for PDCET aspirants is that they get less time because most of them have already done their DCH and they have to manage in job versus studies. So, but I think it's sufficient if they study 4 to 5 hours a day, and for last 1 month if they can manage to take few leaves and they can start preparing well. So this is again Pediatrics MCQ series, and this is beneficial for NEET, PG, FMGE and PDCET exam going students. And we have planned around 80 to 100 topics, and from each topic we will take approx 20 MCQs, and I will try to post them daily. So topic 1 for today is normal growth parameters, and just want to introduce, yes, most of the students know that I'm running this MCQ next channel on WhatsApp, Telegram and YouTube and various other platforms since last few years, and many of the PDCET aspirants has joined in my courses in last few years. So this time I'm starting this MCQ series and trying to help you guys, and you can subscribe this channel Shishu Care for all such videos. So now without wasting any time, we will go to the MCQs. So first MCQ, average birth weight of a term Indian newborn is. Okay, so the options are 2 kg, 2.5, 3 or 3.5. So just after reading this question, you should try to recall in your mind the answer, and the answer for this is 2.5 kg. The average birth weight of a term Indian newborn is 2.5 kg. Few important points about this: that average term birth weight is, in the Western data says that it's 3.2, but we will go for Indian reference and it's around 2.5 to 3 kg, and the definition of low birth weight is less than 2.5 kg. So answer for this MCQ is 2.5 kg. So now next is normal weight loss in a healthy normal weight loss in a healthy term neonate during first week is. So what is normal weight loss in the healthy term neonate for during the first week is? Options are 2 to 3, 5 to 10%, 10 to 15 and more than 15%. So here the answer is 5 to 10%. So these are basic, very easy questions, but sometimes in exam we get confused with such questions also because options are quite nearby. So due to loss of extracellular fluid in meconium, and this weight should be regained by 10 to 14 days. So 5 to 10% of weight is lost during the first week after delivery in a healthy term neonate. Birth weight is usually doubled by, so when birth weight gets doubled, 3 months, 5 months, 6 months or 9 months. So answer for this is around 5 months. So birth weight milestones we should remember: it doubles by 4 to 5 months, it triples by 1 year, and it quadruples by 2 years. So usually they ask for doubling time or tripling time of birth weight. So it's 4 to 5 months for double, and it gets tripled by 1 year. Next question is birth weight tripled by, as we have already dealt in the previous MCQ. So it's 12 months. Okay, so birth weight is tripled by 12 months. Now average weight gain in the first 3 months of life. What is average weight gain in the first 3 months of life? Options are 10 gram per day, 15, 20 or 30. So answer for this is 30 gram per day. So for first 3 months of life, the average weight gain in a newborn is 30 gram per day. So weight gain for the first year of life for 0 to 3 months is 30 gram per day. For 3 to 6 months, 20 gram per day, and for 6 to 12 months, it's about 10 gram per day. So mostly this 30 gram per day is asked. Next is average birth length of a birth length. Okay, birth length of a term neonate is 45, 48, 50 or 55 centimeter. So the answer for this is 50 centimeter. So average birth length of a term neonate is, most appropriate answer is 50 centimeter. So these are basic theoretical points, and try to remember them. And length at 1 year of age is approximately. So what is the length of a neonate a baby at 1 year of age? So the length is 75 centimeter. How 75 centimeter comes? Explanation will give the answer. So length increases by 25 centimeter in the first year. So birth length is around 50 centimeter as we have seen in the previous MCQ. So 50 plus 25. So in the first year, at the end of first year, the length of the baby is around 75 centimeter. Height doubles from birth by 2 year, 3 year, 4 year or 5 year. Height doubles from birth by 4 years. Now expected height at 2 years if birth length is 50. What is expected height at 2 years if birth length is 50? Now answer for this is 90 centimeter. How it comes? First year plus 25 centimeter, so 50 plus 25 it is 75 centimeter. Second year again then plus 50 plus 12, so 75 plus 12 it comes around 87, but in option 87 is not there, so nearest is 90 centimeter. So we should, this is actually the minimum criteria, so we should not choose 85 in this question. We should choose the next higher value, that is 90 centimeter. Now average head circumference at birth is, this question is for head circumference, so what is average head circumference at birth? It is 34 centimeter. Now head circumference increases most rapidly during, so the most rapidly during, the answer is first 6 months of life it increases most rapidly. So now this is quite tricky question. In first month, first 3 months also it increases rapidly, but overall if we go through the stages of life, so for first 6 months it increases rapidly. So for appropriate answer in this MCQ is first 6 months. Just after seeing the first option or second option, don't take those answers. First 6 months is the cumulative head circumference growth, so it increases more rapidly during first 6 months. Head circumference growth for first 0 to 3 months it's 2 centimeter per month. 3 to 6 months it's around 1 centimeter per month. Now head circumference at 1 year is approximately, it's 46 centimeter. At 1 year it is 46 centimeter. And head circumference at birth is normally how much centimeter more than the chest circumference. So head circumference at birth is how many centimeter more than the chest circumference. So answer is 1 to 2 centimeter. This is important. Now at birth the head circumference is more than chest circumference. By 1 year of age head circumference is equal to chest circumference. So MCQ has been asked previously in some exam that at what age usually the head circumference gets equal to the chest circumference. So answer is 1 year of age. Normal head circumference in 6 months is approximately, so at 6 months it is approximately 44 centimeter according to, if these options are given. A head circumference crossing percentile lines upward suggest. So if head circumference is increasing and it's crossing the percentile, the normal percentile line, so microcephaly means decrease in head circumference, so it can't be the answer. Normal variant, it's in crossing the percentile lines, so it's not normal. Malnutrition again will not lead to increase in the size of head, so the most appropriate answer here is hydrocephalus. So head circumference crossing percentile line upward suggests hydrocephalus. Weight for age below -2 standard deviation indicates wasting, stenting, underweight or obesity. So this question is about weight for age, and if it is below -2 standard deviation, then the answer is this is underweight. So weight for age less than -2 standard deviation is underweight. Now these few terms, weight for age, if it's -2 standard deviation then underweight. Height for age, if it's less then it's stenting, and weight for height then it's wasting. So underweight, stenting and wasting, these three terms we should remember, and for what parameters it's used we should remember that. Now best parameter to detect chronic malnutrition. Chronic malnutrition is weight for age, weight for height, height for age or BMI. So for chronic malnutrition, remember that chronic malnutrition affects height for age. A child who is chronically malnourished, his height for age will decrease. Which growth chart is recommended for Indian children? CDC, IEP, WHO or both B and C. So as you have seen in your clinical practice, IEP and WHO chart are commonly used in Indian children. So both B and C is the answer for this question. And for less than 5 year child, WHO charts are usually used. For 5 to 18 years, IEP charts are used. Now maximum postnatal brain growth occurs by Theoretical question, maximum postnatal breakdown occurs by, so answer will be 2 years here. And the last MCQ, incorrect statement regarding growth. Weight faltering precedes height faltering. This is wrong or right? I think this is right. Head circumference reflects brain growth. This is right. Height is sensitive to acute illness, and head circumference grows rapidly in infancy, as we have already seen in previous MCQs that head circumference grows rapidly in infancy. So height is sensitive to acute illness. This is wrong. During acute illness, weight is affected, and during chronic illness, height is affected. Okay, so always this is common sense and you know this well. So the incorrect statement is height is sensitive to acute illness, weight for acute illness, and height for chronic illness. So these were some questions from basic growth parameter. These are very basic questions. Every day we will take one such topic and 20 MCQs from that topic. And if we complete these topics in time, then a few days before exam we can also go for some marathon classes covering many topics or some unit wise classes like for neurology separate or cardiology and like that. So thank you for your patience listening. Go through these MCQs. These might look simple, but sometimes in exam pressure during those 2 hours we make silly mistakes, and we should avoid those mistakes. And you can subscribe this channel for future for getting further videos. So thanks a lot everyone. This is for